I'm going to pretend that Rosemary Barton invited me over as a guest speaker. Good question, and thank you again, Rosemary, for my being here. There is an issue that isn't being discussed both in the medical system, but also in most of the other cultures of work industries, and such as education and many other things. And during COVID, there's been many lessons learned, or at least data has become available on these things, whether they were sought as kind of potential, data-related solutions. And it seems that we're avoiding it, and we're avoiding kind of the reality of the cultures that we all have around the world as seriously being broken, and therefore we're in the Anthropocene. And one of them is in education, there has been cultures, including some in Canada, that have hired people that didn't have, let's say, a bachelor's specifically in education, but they had a passion to, and an excitement to be in a new profession and to work with kids, and that weren't burned out and that could learn easily through this motivation to reinvent themselves and to enter a different kind of industry that was what their original bachelor's was in. And it turns out, I believe that if data is objectively collected even further on this, it turns out that they were more efficient in the jobs of educators than people with, the certificates of teachers. And you need to ask yourself this. And it's the same thing when it comes to, let's say, mental health. There are many people that volunteer and that might not even have a bachelor's degree, but that have learned basic counseling skills, which is at the root of a lot of what is increasing in the flaws of mental health services, as we don't have people with care and concern. I mean, they could have as many PhDs or MDs or other diplomas or years of experience, but if they won't bother, and of course anybody can notice, even if it's just unconscious, when somebody notices these nonverbal behaviors from another, but they can notice that their voice or their story or their suffering doesn't matter to the service providers that are in these professions, that have these certificates, diplomas, years of experience, references, but that are still failing their clientele. So if we can make, Rosemary, the child-centered or learner-centered or patient-centered paradigms at the forefront, and hire people that would do a better job if we are patient-centered, learner-centered, then we also have to decide it's not just about training somebody new in a particular, let's say, industry such as nurse, but in ways that when they're being trained, they're turned into domesticates in the old ways that didn't work and are frustrated about it. And they'll still believe, and this is the beginning of their mental illness, that they can change things from the inside. It's wrong. You need to make a big change of the staff in education and medical services by having maybe the old staff who think they're already doing this, but very likely not, but hope that they would, if they want to reapply to pass for these exams as well. It would be, these are the standards for being patient-centered or learner-centered that we will expect from ourselves if we're still energized enough to stay in the industries, or also from newcomers that have education that might not just be a tiny bit different, but maybe very different, but that can write a document or answer questions in an interview and accept a transparent probation period where they will be able to demonstrate patient-centered, learner